COVID-19 infections on the rise, is Kenya staring at another lockdown? Reports indicate that hospitals around the country are filling up with coronavirus patients. This following relaxation of most containment regulations. Some schools have been forced to shut down barely a week after partial reopening following high numbers of the virus. A second wave of the pandemic is also being witnessed in different parts of the world. Let's now speak to Dr. Andrew Were, who is the president of the Kenya Medical Association. Dr. Were, many thanks for your time. Kenya yesterday recorded 1,068 cases of COVID-19. The last time we saw these numbers was back in mid-August when the government regulations or restrictions were still in place. What do you attribute this surge to?
Thank you for having me. I think the surge that we're seeing, the 1,068 numbers that were reported by the Ministry of Health yesterday, it's attributed to the easing down of the restrictions that we are seeing all over the country. We are seeing the public are not complying to the Ministry of Health protocols, and it was just a matter of time when we'll have these high numbers being experienced in the country. So it's a result of the easing of restrictions all over the country that has led to increased surge that you're seeing.
So back when we were seeing these numbers, like I said, when government restrictions were still in place, the pressure on health facilities and the health sector was quite dire. What is the situation now with this surge?
Now with the increased numbers, of course, the pressure has increased. The advantage that we have as a country is that we had time on our side, and we were able to prepare the counties well in advance so that they can be able to handle any surge. Of course, together with the opening of the school, then we have seen some of them, we have seen infections like in Mombasa where we saw some teachers being infected. And with the full opening of schools, of course, we'll see the more infections rising up because of the transmissions that are expected. So the hospitals are overwhelmed, but we have the advantage that we got time to prepare well to respond.
And we've seen a resurgence in various parts of the world, especially in Europe, France, Italy, many of them being affected. With this second wave coming, from a medical standpoint, what should we be preparing for?
From a medical standpoint, I think what we need to do is to ensure that all our county health facilities are ready to receive any increased number of admissions as a result of this COVID-19 pandemic. Meaning we need to get more healthcare workers on the ground who are properly trained to handle the coronavirus infection. We need to have the proper hardware in place. These are the ICU, HDU facilities. We have to have enough supply of oxygen in our institutions so that we can be able to respond in case a similar scenario that is being experienced in Europe right now comes to this country.
All right, many
so
had
it's
faulted.
a matter of now.
Go ahead.
Just getting prepared as in our facilities to ensure that we handle this pandemic well.
All right. Many had faulted the move to test only those who are symptomatic, with many saying that those who are asymptomatic, do not know they have COVID-19, are likely the ones spreading the virus altogether. So are we looking at possibly changing the targets for who is being tested?
There's one thing that might not enable us to actually do the mass testing is the shortage of kits, which is being experienced worldwide, and especially now that we have new surge infections from the countries that are producing these kits. Then there'll be a shortage of testing each and every person. The mass testing that is actually one of the core ways of handling this infection. So what we'll still insist on is we do targeted testings. Once we do targeted testing of the symptomatics, we can do screening, as we have seen the NMS doing, which is very commendable, in counties where we are experiencing a surge of infections, and then be able to put restrictions back in place so that we can be able to control the infections where they're happening and they do not spread throughout the country.
All right, let's talk now, because with COVID-19, doctors and health workers, of course, are at the front line. What is the state of the recommendations of the COVID-19 Human Resources for Health Guidelines? Because in this month alone, we've seen about 217 health workers, according to the KMPDU, contract the virus. At least 16 have succumbed to the virus as of April this year. What is the state of those recommendations?
I think we really need to do more training to the healthcare workers, especially in our counties. And I'm happy to report that KMA is participating in training of healthcare workers. And I also think that we need to provide the PPEs to all these healthcare workers so that they can be able to be protected as they provide healthcare to the public.
All right, many thanks. That is Dr. Andrew Were, President of the Kenya Medical Association. They're speaking to us on News Desk about the possible COVID-19 surge in the country. And from that into sports news, and Jose Mourinho praised Tottenham debutant Carlos Vinicius following their 3-0 defeat of LASK in the UEFA Europa League on Thursday. Mourinho hinted the striker on loan from Benfica could feature alongside current